What is the definition of jaundice? Jaundice in French means yellow, which the condition where the person's skin and sclera discolored yellow by abnormally high blood levels of the bile pigment bilirubin. There are three classification of jaundice based on pathological basis, which is pre-hepatic jaundice, hepatic jaundice, and post-hepatic jaundice. Prehepatic jaundice occurs due to increase in breakdown or degradation of hemoglobin. It is characterized by increase in serum unconjugate bilirubin in body, less or absence of bilirubin in urine, and dark brown faces. Hepatic jaundice occurs due to damage of or dysfunction of liver. It is characterized by decrease in fecal urobilinogen, dark color urine, and increase in ALT and aspartate transaminase.
Obstructive or post-hepatic jaundice causes by obstruction to biliary movement to hepatic cell. It is characterized by increase in conjugated bilirubin levels, bilirubin in urines, and increase in alkaline phosphate ALP, ALT, and AST. Normal jaundice in newborn. Normal newborn jaundice is the result of two conditions occurring at the same time, a prehepatic and hepatic sources of excess bilirubin. The baby at birth immediately began converting hemoglobin from a fetal type to an adult type. The fetal type of hemoglobin was able to extract oxygen from the lower level of oxygen in the mother blood. At birth, the infant can extract oxygen directly from his or her own lung and does not need the fetal hemoglobin anymore. So fetal hemoglobin is removed from the system and replaced with adult hemoglobin. The resulting in bilirubin load the system and places demand on the liver to clear it, but the liver is not quite ready for the task, so there is a period of week also when the liver has to catch up. Okay, there are several etiology of jaundice or causes of jaundice, which are acute inflammation of liver, hemolytic anemia, obstruction of bile duct, inflammation of bile duct, Gilbert syndrome, cholestasis, or flow of bile from liver is interrupted.
Pathophysiology of jaundice result from two phenomena. First, bilirubin production is elevated because of increased breakdown of erythrocytes. Second, increased blood destruction, for example, hemolytic anemia. Third, decreased hepatic uptake due to the impaired conjugation of bilirubin, intrahepatic cholestasis, hepatocellular injury, and extrahepatic obstruction. There are 6 symptoms of jaundice. First, yellow discoloration of skin and white eyes, skin itching and skin rashes, feel fever and flu, lose weight quickly, feel nausea and vomiting, and produce light color of stool. Diagnosis. There are 4 techniques to test jaundice. First is liver function test, liver biopsy, urine test, and imaging test. Liver function test is a blood test that measures level of certain protein and enzyme that the liver produces when it is healthy and when it is damaged. Blood can be tested for infection known to trigger jaundice, such as malaria and hepatitis C.
Liver biopsy. The procedure also helps to assess the stage of liver disease. A small tissue sample is needed to confirm the conditions such as cirrhosis or liver cancer. This procedure can be done through abdominal wall and also jugular vein. A liver biopsy may be done to find the cause of jaundice, and also blood test result from AST and ALT tests. For urine tests, urine can be tested for urobilinogen, which is produced when bilirubin is broken down. When higher than expected level of urobilinogen in your urine may suggest pre-hepatic jaundice, and lower level could suggest post-hepatic jaundice. And for imaging tests, there are four, which is ultrasound scan, CT scan, MRI scan, and ERCP scan.
Jaundice prognosis in newborn. The majority of children with jaundice will recover fully and without permanent adverse effect. Sometimes a baby will need light treatment in a hospital to lower bilirubin levels. Jaundice prognosis in adult. The prognosis for individuals with jaundice depends on the underlying causes of illness. There are certain conditions that carry an excellent prognosis, making a full recovery. However, more serious causes of jaundice can sometimes be fatal despite medical or surgical intervention. The development and severity of complication will also determine an individual prognosis, as will patient underlying health and comorbidities.
There are several treatments for patients with jaundice, and the treatment is depend on the cause of underlying condition and any potential complication related to it. The treatment includes self-care and home. Maintain adequate hydration and rest. The patient should take medication as instructed and prescribed by healthcare practitioner. Provide adequate milk intake for baby in case of breastfeeding jaundice. Besides, medical treatment also is given, which includes supportive care, antibiotic, antiviral, blood transfusion, chemotherapy, and phototherapy. Medication and surgery. Surgical treatment may be necessary for the patient with cancer, congenital malformation, condition that obstruct the bile duct, gallstone, and also abnormalities of the spleen. Liver transplant were also conducted for the patient. Follow-up will be carried out. The patient should closely follow the instructions from the healthcare practitioner, and also additional blood testing imaging study may be required for the patient. The patient should discuss with their potential complication with healthcare practitioner and also seek medical attention.